Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinna Hankins, and this is
A Podful of Pediatrics. And this is the one where we talk about influenza. So influenza is a respiratory illness, causes cough, congestion, fever, body aches. I mean, it makes you feel terrible.
It is not, however, the stomach flu.
No, that's a different thing. Vomiting, diarrhea, different viruses, a bunch of different viruses.
So it's always like one of those, they're like, oh, I've already had the flu. I don't need influenza, the influenza vaccine. I'm like, what did you actually have? And a lot of people are like, oh, I had vomiting, diarrhea. That is not the flu.
No.
Influenza is a much different being than what we call a gastroenteritis, which is vomiting and diarrhea.
And if you've ever had real flu, you feel terrible for at least 5 days, but up to 2 weeks.
That's right. And you can have high fevers for that long. Like, it is one of those things. There's very few viruses that have long persistent fevers. Influenza is actually one of them. And high winds, they can be 101, but they can also be up to 105. And you can have those for 5 to 7 days straight as part of just a normal influenza course.
And just everything hurts. Your whole body hurts.
Yeah.
You can't even move.
Yeah. And the hard part is that while that's even a normal influenza course for people, for most people, it actually is much more deadly and dangerous with many more complications and higher risk groups. And all of those higher risk groups and those higher risk flus and influenza can be deadly and does cause deaths every year.
And the highest risk groups are babies.
Yeah, infants, children with underlying heart or lung condition, including things like asthma, and then children with decreased immune responses. Children and adults with decreased immune responses are all much higher for the risks or the complications of influenza.
Yeah, and influenza has been around a long time.
It has, yeah.
It's a virus that's been around for centuries. 1918 was the big influenza pandemic, was the first one that's really documented and studied. And it was estimated to infect 500 million people worldwide, which was a pretty large percent of the global population at that time.
Absolutely. And it killed 20 to 50 million people.
And it's a big range there because no one kept track of the exact number.
That's right. But it was so deadly. It was such a fast-acting virus. Nobody knew what to do.
Right.
Right? This had never happened before when there were enough people and the world was more mobile, right? So it spread throughout the world. And it was really, the resulting death rates were so high that life expectancy rates around the world dropped by several years just secondary to this pandemic.
And more people died as a result of that pandemic than in the First World War.
Yeah.
Than that.
The rate of influenza hospitalization or complications is greater in those children under 5 years. Yeah, now.
Not
sorry.
back in 1918.
Not in 18, but not in 1918. Sorry. We're switching course. Now we're talking about influenza and the burden of influenza and kids. And so in children less than 5 years, your rate of possibly needing or having complications and needing hospitalization is higher in that age group under 5.
Yes.
The hospitalization rates for the less than 6 months is 237 per 100,000.
It's very high.
Yeah. And then your hospitalization rates for over 6 months to 4 years is more like 55 to 100. So still pretty high.
Pretty high, yeah. And and kind of the interesting part about influenza, it is definitely worse when you're younger or have a pre-existing health condition, but it can be really bad for everyone.
It can.
And 50% of the kids hospitalized had no underlying medical condition.
Yeah.
They just got a big dose of flu and got really sick with it.
Right. And if you look, it is actually still, and we have this graph in our podcast notes. But if you look at pediatric flu deaths by year, actually last year was one of
a really bad year.
It was
the highest one since 2009 in the swine flu.
Yeah, 219 deaths last year in children from influenza. Yeah. And that is the highest since swine flu. And I think a large part of it is, again, because people aren't vaccinating.
As much, yeah.
And flu is one of those hard ones to understand.
Yes.
Like when we always talk about measles, we're like, you get the vaccine, you will not get measles.
Right. It's a very effective vaccine.
It is incredibly effective. And the likelihood of getting that illness after you've been vaccinated it's really low for things like measles, chickenpox, right? There are some of our vaccines that are just really effective at eliminating that type of illness. Influenza is different.
It is. It's a virus that's always changing and has multiple subtypes within it. And so trying to get a vaccine to match it is pretty difficult.
Yeah. And so that's that's really what a lot of this has gone around. We're going to talk about how to do that, but I will say that some of the only other things we forgot were complications.
Yeah, complications of flu. So we say it's like a respiratory illness. So ear infections and pneumonia are common secondary complications, but it also can affect the central nervous system.
Right. You can get meningitis or encephalitis, and that actually is one of the common causes of death.
Yes.
With it's either typically pneumonias where you can't breathe and you have to be on a ventilator and be assisted, and sometimes you just still can't get through it. Or encephalitis is one of the big causes of death in influenza.
Another complication that we see, I always see at least one kid every year, is acute myositis, which is a breakdown of the muscle from all the inflammation that the flu causes. And these kids are so sad. They cannot walk. They have pain all over their body.
But really, especially in the calves for some reason. Like, it is super impressive and really sad because these kids are so hurting. But you'll squeeze their calf and they will scream. Like, it is like, I'm like, oh, it's influenza. Like, I don't even I'll run the test, but I'm like, this is what that is, right? Like, I know because that is one of the only things that causes that.
And if they have myositis, they have to have lots of IV fluids and lots of rest. And if they aren't treated, they can lead to kidney failure.
Right. And that's just because the breakdown that is from those muscles is really not good for the kidneys. So we need to kind of flush it out. And so IV fluids and hospitalization are what they need. So we're going to talk now a little bit, how do we come up with a vaccine? Because that's what one of all of these talks about vaccines, we're talking about how the different ones came about and why is this different than your measles
primarily
vaccine?
2 strains of influenza, A and B. There is a C, but C has not really caused any outbreaks at this point. More to come in the future, I'm sure. And then within the A's and B's, there's different subtypes. So that's what we're always kind of looking at, is how to make that vaccine match the subtypes
that are going to be present in any season.
Right. And
it is a little bit of art and science together, right? Like, science kind of does some of that. Like, hey, this was around last time, or it might be here. This is what's around in the area, so we might see that. But also like like these usually go together, and like it very well could be this. And it's kind of the art of science.
But it's a lot of practice in doing it.
It
right?
is, yeah.
This vaccine's been around since the 40s. It was founded in 1933 is finally when the influenza virus was isolated. They thought that bacteria caused the pandemic of the 1918, but then when they realized, there's no bacteria in these people, there's only viruses, they were like, this is the problem. Mm-hmm. And then with support from the U.S. Army, the first inactivated flu vaccine was developed by Thomas Francis and Jonas Salk.
So we hear again, he was like a major factor in vaccines. Yeah.
At the University of Michigan. And it was initially used by the military before it being licensed for wider use in 1945 at the end of the Second War.
And there are now several different types of influenza vaccines that are licensed for use in infants, children, and adolescents. And the most common one that everyone is used to is the inactivated influenza vaccine.
It's been around since 1945.
That was the original one.
It's not a new vaccine.
And it's not only not new, but it's also, remember, it is a killed virus vaccine. So it can't give you flu.
No.
Like, it is dead.
People say, I always get the flu vaccine. Well, either you got exposed to flu around the time you got the vaccine, or your body's just reacting to the fact
that it's making antibodies and
trying to fight off.
Like, allow you to fight it off in the future, right? Those are the antibodies that it's making, but you are not getting the flu. The part that is left over of the little vaccine and the inactive, those little proteins or that are kind of helping you make that antibody cannot give you the flu. And that is the most common one. It's from 6 months to, I think we start giving the adult one at...
now this dose is the same.
That's right. That's right. 6 months and up.
6 months and up, and for the older people, we don't know. There's a high dose one at some age, but we don't need to know that part.
We don't need that.
But then the first year you have it, you have to have 2 doses separated by a month, and that is to basically create a booster effect to help that vaccine be more effective.
Yeah, and that's the only time that you need that booster. And then it is tolerated very well. It works very well. There's another type that was really really worked on because, people didn't always want to get the shot, right?
Yes.
And so it's called the LAIV attenuated, and it's a nasal the spray that is a live attenuated vaccine.
Yes.
And again, it means that they do a live vaccine, but they basically like wash it over and over and over to get just down to the protein that you need to make
recognize it, to make an antibody.
Yeah.
Right. So you cannot get the flu from it.
Again.
No.
But it goes in the nose. It has had a little bit of a
up and down in efficacy,
course.
right? It was
Yeah.
really effective when it first came out in the early 2000s, and then after the swine flu became more prevalent, it was not as good, and so it got taken off the market for a while, and then got a reboot in 2018, and now is as effective as the shot. It's
Yes.
ineffective, or
Yeah.
the dead vaccine.
Yeah, inactivated.
Thank you, inactivated vaccine. Yes.
It can't be given to certain populations. So the live attenuated or the live attenuated influenza vaccine can't give it to kids under 2. You can't give it to pregnant women or immunocompromised patients. Or kids with severe asthma actually shouldn't get the
They're just more
live
likely
attenuated.
to cough and wheeze.
Have a little more trouble with it. And then otherwise people with cochlear implants and a few other conditions. But for all those otherwise 2 and above can get the
FluMist.
FluMist.
So if a kid really doesn't like a shot, it's definitely a good option.
Yeah, it is. And then you also have a third option now, which is the trivalent recombinated influenza vaccine, which uses the recombinant DNA technology. Mm-hmm. And it is nice because it is completely egg-free.
It is.
So just so you know, you can give influenza, even though influenza is initially, the influenza vaccine is initially cultured in eggs. There is not enough of those proteins to cause any action, even with somebody who has an egg allergy. So it is absolutely safe to get a inactivated flu vaccine if you need to. However, if you're really worried about it and you have an egg allergy, this is actually egg-free and available for everyone over 9 years of age.
Yeah.
And so one of the things we talk about with influenza, though, is why is it always not as effective? Like
right.
In the sense, or do we think it doesn't necessarily keep you from getting it?
It differs year to year how effective the vaccine is, and it's because they're guessing, based on data from the Southern Hemisphere, because they go through their winter first and get their flu, and that's how they decide what to put in the vaccine
right.
for the Northern Hemisphere. And so they're just trying to be like, okay, is this one going to match or not? And sometimes it doesn't match.
Yeah, sometimes we don't get it right.
The virus changes way too much. And viruses are smart, right?
Yeah.
Like they're kind of like, I want to live. And so they just kind of keep changing, and they
live.
They give this evil laugh, I'm coming to get you. And so no matter what you do, the virus is going to come get you.
That's right. And so what I find fascinating, and they have actually found studies to back this up, is that if you do get a flu shot every year, though, while it might not keep you from getting the flu completely, you will have a much lighter course.
Oh, for sure. We definitely see it in evidence, and we see it anecdotally, right?
Oh, right. Yeah, like in our office. Like I've had multiple times where I'm like, I see a kid come in for their well visit, so we go ahead and give them the vaccine, and the mom was gonna bring the other kids in,
but in the interim, they got the flu.
They got the flu, right?
Yeah.
And then all of them will come in, and you'll see the child who didn't get the flu shot, and they are so sick.
They just lay there like they want to die. They don't even move their head. They don't even pick their head up at all. It hurts too much.
I know. And then the other kid's like running around the room, still with a little, maybe a little runny
fever,
nose,
has a positive
cough,
test, but you're like,
yeah.
You know what? It helped.
Yeah. So it really did make a difference. And I find that even with myself, like I get flu shots every year. I have my kids get flu shots every year. When we've had flu, it just wasn't as bad a thing. Not fun, and not certainly something you want to have, but like it just wasn't bad.
And 2009 was the swine flu year, and so that's the year where a lot more people got the flu because it was a new strain that the vaccine had never had. And that was the first time I remember having the flu, and I felt terrible. And after that, they started including that strain in the vaccine, and so we haven't had that big outbreak until this past year when less people had flu shots.
Yeah, and that was really the reasons for the bump up last year, and both more people having flu and more hospitalizations and death from flu. So again, the vaccine is incredibly helpful. There's really the flu vaccine is very similar to the one that was in the Southern Hemisphere. So like there's really no updates on the changes in that. But the CDC did report that the vaccine this year has about a 50% effectiveness against hospitalization in the Southern Hemisphere. And so it was pretty effective, which is good news. And then every year they have to make an educated guess on that. But this year seems to be pretty good.
And kind of the deal is, not everyone can get the flu vaccine. If you're the baby's less than 6 months, if you have some kind of medical condition like history of Guillain-Barré, you cannot get the vaccine. So it's super important that everyone around those people get the vaccine.
Yeah.
Right. And that's really important for babies because they're the ones at highest risk to die from it. So all the caregivers really need to make sure that they have the flu vaccine.
Right. And there are treatments. So let's say we do get we're not very good at treating viruses. So again, if you've learned nothing from any of these podcasts,
viruses are hard to treat.
Viruses are hard to treat. And there are some things that we just aren't good at treating.
Yeah.
And there are a couple of things that we can use for the flu virus though.
There is some antiviral medicine.
Right. And one of them is Tamiflu. And so your doctor might talk to you about that especially if you haven't been vaccinated and you get the flu. It's a pretty tolerable medicine.
It can make you feel kind of nauseous and kind of with little kids, sometimes it makes them have like hallucinations and act.
Or more, I call them vivid dreams.
Yeah, they get freaked out. And so Tamiflu does shorten the duration, but doesn't make you not contagious and doesn't make it go away. So it's worth trying if it's in the first day or two of being positive for the flu.
And you actually have to have it in the first, if you don't use it really within that first 72 hours,
it doesn't
make
a difference, and the side effects are not worth it.
Yeah, but it can be, especially for I feel like young kids in that time period, if you catch it early.
But if they start vomiting or having crazy dreams,
don't do it. Yeah.
And Xofluza is a relatively new one. It came out right around the pandemic, so it didn't really get to hit the market because the amount of flu was decreased down when we weren't seeing each other during COVID. But Xofluza is a one-time medicine, 5 and up, that is well tolerated, and it actually does treat your symptoms pretty quick. It's just super hard to find and expensive.
It is expensive, yeah. And I actually have tried to get it here a couple of times and not been able to do it. But so that's kind of influenza. So really what we're trying to get through here is that it is a safe, very effective vaccine that can prevent hospitalizations and deaths from influenza. And you should get it. It's a good vaccine to get, very few side effects, again, really useful. So one of the other things we do in these vaccine podcasts is talk about updates or myths. And we did want to update a little bit about the measles. That was kind of our first vaccine talk. And there's, the information or what's going on about measles the information out there has dropped. It's not gone, unfortunately.
There's still an outbreak of measles.
There is an outbreak of measles still. It is better in Texas than it was before, meaning that it has the outbreak seems to have kind of under control there, but it's still spreading in pockets of undervaccinated communities all throughout the U.S. otherwise. And we did have another death from measles. It wasn't actually from this outbreak. It was from an outbreak that happened actually in California years ago. And it was the thing we talked about, the panencephalitis.
Right, which is the one that basically they're in a coma.
Right, and so and that can happen anytime after you get the measles infection. And so it can happen years later, which it did in this case, and almost always leads to death. Again, one of the reasons we vaccinate, because you cannot get panencephalitis if you get the vaccine, period. So even if you recover from measles, you can still at any point get this panencephalitis, which is what happened for this child. But the measles otherwise has been quiet, but still climbing.
Right.
Now we're over 1,500 cases, which is the highest in 30 years. Utah and Arizona are seeing the highest outbreaks at this point. In Utah, there's 44 cases, and it's being identified in wastewater, which means
more is to come.
Yeah, there's more to come. And then in Arizona, there's 52 cases, all in almost even 2 elementary schools that are very under-vaccinated. Yeah. So measles is still there. It is still really important that you get vaccinated and get your child vaccinated if they haven't been, especially if you are in an area that there's any type of outbreak. The other thing we were going to talk about is kind of one of those ideas that maybe isn't really true. That we're
It's a
getting
lie.
more now. A lie.
A lie.
A lie, I guess.
Yes, it's questioning the germ theory, which is almost kind of funny, right?
I know, right.
Like this, I feel like we're in 1802 again.
Yeah.
Questioning the germ theory, it's been around a long time and has a lot of evidence behind it.
Yes, yes. And it's like that same thing, like, right? Like they thought influenza was a bacteria, but then they realized it was a virus. Both are germs.
At least they were admitting they were germs, right?
That's right.
That's a thing, and it does exist, right?
Right.
It's not some kind of vapor,
There's
right?
not.
No. There's actually like little proteins that move and get into your body.
That's right. And you can get it from somebody coughing on you or like,
or a lot of them
from
like
on the
Coxsackie,
surfaces.
just sitting on a table for a long time and it'll get there.
But all those are germs that kind of enter your body and do it. And it's not like this direct, like, oh yes, of course germs exist. Now it's like, actually, if you're healthy enough, germs won't get you. Like,
and you know, we talked about viruses are equal opportunity. they will come for you no matter what you do, right? And definitely, if you make healthy choices, you eat well, you sleep well, you don't smoke, don't do drugs, you're more likely to handle that virus better, but you're still going to get it.
You're still going to get it. Yeah. And that's true. Like, and unfortunately, it also doesn't necessarily mean that you won't get really sick from it.
Right. And especially your child.
Yeah.
Right? And that's the difference. That's what we talk about, right? Is babies don't get to choose if they're vaccinated or not. Their parents get to choose. And babies are just way more at risk if they get that virus. No matter how healthy they are, they might die.
Right. And that's, you know, one of the things that we talk about. Like, is there a difference between children in Africa who have malnutrition and how they respond to a virus or bacteria? Yes, of course it is. But it doesn't like negate the fact that even with good nutrition, you can still get really sick from these things. And the only way to protect in both those areas or cultures is to vaccinate when available, to truly protect you against those. It is good still to have a good, healthy nutrition, right, and get a lot of sleep and make sure you maintain a good weight. All those things super important.
Wash your hands.
However, doing all those things and taking a bunch of dietary supplements are not going to keep you from getting sick, unfortunately. If it were that easy, it would have been done a long time ago. And that's the thing about it, is the thing that does actually work and is pretty easy is the thing we have done, which is vaccines.
Which is much cheaper than all the supplements.
It is much cheaper. And that's the other thing that I like. I get really so sad sometimes, and I have families come in and they're like, but I'm giving them the best organic food, and I'm like buying all these like dietary supplements, and I'm doing all of these things, and they still got sick. And that's the problem with it, is that it's a lot of money, and a lot of money for those things that don't work. I don't even necessarily tell people to do a multivitamin. If you have a child that's actually eating healthy.
We know that it's much better for your body to have nutrition, right?
Right.
To have vitamins through foods. If you're doing it through a multivitamin and you don't need it, you're going to pee it out.
That's right.
It's a waste of money. I mean, there are some kids who do need supplements because for whatever reason, they have, can't absorb certain vitamins, or they have some sensory issues that they don't eat food.
I have kids who, like, truthfully for like 2 years won't eat a certain food, and then just won't eat it. Like, you're like, okay, well then we probably do need to supplement it.
For a kid who eats a pretty well balanced diet, you don't need to do a multivitamin.
No,
they're getting what they need from those foods, and you're just wasting your
money.
money.
You certainly don't need to do extra supplements.
No, sometimes they can be harmful.
Yeah, and spend your money on good food. Like, if you have
it doesn't have to be organic.
It doesn't have to be organic, and it can't just be good food. Healthy food, meaning fruits, vegetables, meats, dairy, all those things that we have in really good portions. That's where you kind of emphasize for children to keep them healthy. And when people get sick, recognize that it is the germ to blame.
It is a germ, right? And some, I have a
They're
lot of
evil
bacteria.
germs that like defy you.
Yes, it's evil.
Where's your evil laugh?
I can't do it right now. But at the end of the day, the things that have been the biggest changes in public health, right, are flushable toilets.
It's really nice.
Really
Sanitation's
nice. Super
so
important.
good.
Sanitation's so important. And vaccines.
Yeah.
They're the ones that have stopped babies dying as much.
That's right. Definitely. So yeah, balanced diet, exercise, sanitation, all incredibly important, but they are not a magic cure for infectious disease. Vaccines actually kind of are a magic cure, but.
And in our podcast notes, we have the recommended fall 2025 vaccines, like what ages for influenza, the RSV protection, and the COVID-19.
Yeah. And then the last thing I just wanted to talk about is something that came out, and it's not really to do with vaccines, but it is talking about autism, which we talked about again in that first podcast. And recently, there was, our government sort of put out a statement, and it was actually a statement on X. So there was really no data behind it, but unfortunately it was linking actually citing a causal link between Tylenol or acetaminophen.
You said that so well.
I know, thanks. And autism.
Yes. And well, during pregnancy.
Right, during pregnancy. Well, and infancy, actually. They actually added that on, even though there was literally no data on that at all. But yes.
And it's one of those things that it's really hard to differentiate why you take acetaminophen from taking acetaminophen. Because why were you taking it during pregnancy and infancy? You probably had a fever or you probably had pain. Both of these things cause inflammation, which we know can affect a growing brain.
Right. And so how did this come about? Like, how did even the idea of Tylenol or acetaminophen use during pregnancy, why did people start studying it? And it was really investigated, and it's been investigated for a long time. And it was based out of some studies on rats, actually, where they did really, really high doses of acetaminophen and Tylenol, other things and noticed, hey, when we did these really high overdoses, rats had trouble, neurodevelopmental problems.
Yeah, how do you know that a rat is autistic?
I don't know, but they had neurodevelopmental problems.
That would be an interesting thing to study. Like,
I don't
know that a rat is autistic.
But anyway, that's how this got started. And then the paper behind this headlines was really a Harvard Mount Sinai study. And it was actually a study of over 46 different papers that looked at associations between Tylenol and neurodevelopmental disorders, not just autism.
No.
And in fact, only 6 studies specifically studied autism of those whole 46 studies. 27 of the studies found a positive link that it was correlated. Again, correlated, not causal.
Necessarily caused.
And then 9 studies had no link. And then 4 studies showed actually a negative link.
Right. That actually was a protective effect, right?
They found that consistent studies so a lot of Tylenol seemed to have more trouble with it. But they weren't randomized control trials because nobody's going to not give, Tylenol is one of the only things we can use during pregnancy for fever.
Right.
We can't use ibuprofen or other ones because they can risk miscarriage and things like that.
And kind of what we talk about is it's not treating the fever just to make people comfortable. It's treating the fever maybe to save their life or save their baby's lives, right? Or actually save them giving birth early, save a premature birth. It's not just to tell them to suck it up because you have a fever. No, we're trying to protect you.
Premature births have been associated actually with autism, and neurodevelopmental disorders. We know that, and we've known that for a long time.
And fever is usually a sign of illness that could cause a premature birth.
That's right. So they looked at those, and then so these were all observational ones where they just basically went back and said, "Hey, did you use Tylenol during pregnancy? Hey, how much did you use Tylenol during pregnancy?"
People don't remember.
I know. It's hard I think we talked a lot about how little we remember from that time.
Yes, postpartum time, your memory gets erased.
That's right. It really does. But that's the reason why these studies really weren't very good in the sense of finding this causal relationship. All they really found was that there was a link. And that link very much could have also been from fever itself.
Right.
And that's why you're using it for viruses, pain, all those types of things. So there was actually a really good study that they didn't include in this statement, which is unfortunate, in 2024. It was a study out of Sweden. And this actually took the evidence a lot further, where researchers did something super clever, which is
sometimes really
they're just really smart people out there.
Yeah,
and
they really are.
I wish I was one of those people. But anyway, they compared siblings. Right. So what they did is they compared siblings whose same mom, same womb, same dad, everything. Right. And mom took Tylenol during one of her pregnancies and not during another. And they compared all of that in this kind of natural experiment where they controlled for all these other factors. And the important thing is that there is absolutely no link between Tylenol and autism. No. So when they compared siblings, there was just the Tylenol autism link just disappeared. And so there really isn't there isn't that causal link between Tylenol. You should not be afraid to use Tylenol during your pregnancy. You should not be afraid to use Tylenol if your child has a fever, in infancy.
2 months and above.
Yes.
Right. We try not to in the first 2 months because we don't want to hide another kind of infection.
Right. And like any fever under 2 months, you don't give Tylenol, you just go into the ER. But after that, you can absolutely give Tylenol. And again, it's the only one we can give in infants less than 6 months because ibuprofen can cause kidney problems. Right. And so we don't use it.
And again, you're treating your child when they need it, right? So they're having fever, they're fussy, they have pain. You're trying to get them comfortable because we know that untreated fevers and untreated inflammation actually is going to cause more problems long term.
That's right. And so again, Tylenol, safe, effective during pregnancy and during infancy. But we're going to look at what does cause like autism. And if you look at, like we said in our last podcast, or our very first podcast, there's a growing evidence that it is highly genetic.
It is.
Probably 85% of the risk is attributed to genetic causes. Interestingly, again, Tylenol wasn't one of those things, and it's because and even another fact against Tylenol being it is that our Tylenol use has decreased.
Actually decreased, right? We've gotten better at preventing illnesses with vaccines.
We aren't using Tylenol
not as much, but our rate of autism has increased.
So if you look at that rate of autism and the fact that Tylenol's gone down, but autism's gone up, again, Tylenol is not a causal thing. But one of the other things that we see is advanced maternal and paternal age.
Yes.
Those tend to cause, be higher risk factors for autism. And then I mentioned that premature births are more likely to be.
And our science has gotten better at saving premature children.
Yeah,
right?
and we definitely
we both have seen that over our time, is that the babies that used to not live when they were born early now live and have an okay life.
Yeah,
for the most part.
But some with neurodevelopmental disorders.
Absolutely.
And prematurity definitely that is the risk for neurodevelopmental disorders. They were really tiny when they came out, and their brains were really tiny. And we're trying to have them do all of that learning and growing in an environment that is different than what they would have had inside.
Yes.
And then maternal inflammation. So infections, high fevers, immune activation during pregnancy has also been associated with neurodevelopmental outcomes. Again, likelihood of why they were using the Tylenol. So,
absolutely. Right.
And that in and of itself has been connected to it. And then other factors like folic acid deficiency during pregnancy, obesity during pregnancy, and air pollution, actually.
Air pollution and drug use during
drug use, and especially during pregnancy.
Especially during pregnancy.
So all of those things have tended to, again, increase our risk for both autism and other neurodevelopmental disorders. So what do you take from this? Germs are real.
They do exist. We have names for them now.
Yes, and we very much want you to have a happy nutrition and lifestyle, happy, healthy nutrition and lifestyle. But also vaccines are going to be your biggest effect against those germs. And then finally, Tylenol does not cause
It is
autism.
safe to use at the appropriate dose, and your doctor will help you figure out the dose because it's weight-based for a kid.
It is weight-based,
but appropriate for their weight.
And actually, it's actually there's a dosing for adults too. Like you don't want to go over, you don't want to overdose.
Per 24 hours, there's like a certain amount you should have. So really follow the labels on the bottom.
Yeah, but if you're following those labels, it is safe and effective for use during pregnancy and infancy.
There.
And so with that, we hope that all this information helps you keep your child healthy, happy, and safe.
So I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is A Podful of Pediatrics. Thank you for listening.
Thank you.